Great. Good morning, everyone. Thank you for joining us. My name is Joan Batorf. I'm a professor in the School of Nursing and director of the Institute for Healthy Living and Chronic Disease Prevention. And I'm delighted to welcome you all here this morning for our session. Before we begin, I want to say that I'm very honored to live, work, and play here in the Okanagan and at UBC Okanagan, where we're situated on the traditional and ancestral and unceded territory of the Syilx Okanagan Nation and their people. And I know some of you might be joining us from elsewhere, and I want to acknowledge the traditional owners of those lands as well. So once again, welcome to the 9th annual Okanagan Embrace Aging Month and our event today. As some of you already know, Embrace Aging is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at UBC and Interior Savings and Credit Union and Interior Health. We've been working together over the last 9 years to celebrate and raise awareness about positive aging. And once again this year, we've organized a number of educational events and activities during the month of March. The sessions are really designed for everyone, young and old, and focus on a variety of topics related to healthy aging and ways to improve quality of life among older adults and their family caregivers. Our goal is to inspire each and every one of us to embrace positive aging. So before we begin today, just a few housekeeping things. You might notice that your screen looks a little bit different than some of the usual screens we have when we do these events, and that is to facilitate some interaction today. So you'll hear more about that later. You might have a closed captioning bar or button appearing on your screen, and you can move that around your monitor, or in fact, close the captioning by selecting the live transcript button on the menu bar. You're invited to type questions and comments in the chat box, or at particular times, our speakers are going to invite comments, and you can also unmute yourself and speak to our group today. So either way is fine. So today's event is brought to you by the Institute for Healthy Living and Chronic Disease Prevention, and I'm especially delighted to welcome our two speakers today. First off is Lizzy Walsh, who is currently a master's in social work student here at UBC Okanagan. And she also holds a bachelor in psychology and a bachelor in music therapy, and is a certified music therapist, and has been doing a lot of work with music therapy, particularly for older adults. And I also want to welcome Kayla Turnbull, who also holds a bachelor of music therapy and is a certified music therapist, and works along with Lizzy. And the two of them have done a lot of work, both in long-term care and other settings, and also with children. So we're delighted to have you both here. We hear exciting things happening about music therapy in the Okanagan, and that our own Kelowna General Hospital is introducing a program like this. So it's very timely to hear more about music therapy and how that might improve the quality of life for everyone. So I'm going to turn it over to you to begin. Thanks so much.
Thank you, Joan. I'm just going to share my screen here, and hopefully you can all see the presentation. Are we good? Can I get maybe one thumbs up, Kayla? Yeah, okay, great. So yeah, thank you so much, Joan. I'm Lizzy. I'm very excited to be here and to talk to you today about music therapy and wellness in aging. And Kayla is going to come in when we go into our participation, but I'm going to present the information for now. I also want to begin with a land acknowledgement to recognize and acknowledge that I live, I work, and I'm presenting from the traditional and ancestral and unceded territory of the Syilx Okanagans people. And also I'd like to touch for a moment here about music and wellness within Indigenous populations, and to recognize the sophistication within Indigenous practices and knowledge around wellness, and that Indigenous people have used music to help facilitate wellness and well-being for time immemorial. So I'm going to be approaching this topic with quite a Western view, and that's the training that I received. But I think it's important to acknowledge and value the history that there is within drumming and music and Indigenous folks. So let's start briefly with a bit of an agenda for today. I'm going to start by doing a real brief introduction on me and our practice of music therapy. And then we'll go on to ask the question I get probably asked most in my life, which is, what is music therapy? And then we'll move on to aging and wellness. And then I'm hoping we can breeze through that information and we can have a good chunk of time on a really fun participation. I won't make you sing, but I will ask for you to engage in that time. So me, a little bit about myself. As Joan mentioned, I have a bachelor's degree in psychology from the University of Victoria, which is where I'm originally from. And growing up, I did musical theater. That was really my music involvement in life, and I sang. So singing is my first instrument. And as I kind of entered the stage of life where you think about what you want to do, I knew I wanted to be in a helping profession, and I didn't really know that I could integrate music into that. So I went into psychology. And then the stars aligned and I got placed with a music therapist as a volunteer position within long-term care, which was my first experience in long-term care and really my first experience with aging. I didn't grow up with my grandparents around me, and so I hadn't really been around any kind of process of aging. And so I was very lucky. I feel very, very thankful that I had that opportunity to see music therapy and to be really immersed within long-term care. And I decided that I wanted to pursue it. I looked it up online. I saw it was another undergraduate degree, and I quickly closed my laptop because I was already 4 years into a psych degree and I didn't want to go back to school. But inevitably, I found myself there, and I completed a bachelor's degree in music therapy. And I moved out to the Okanagan, and Kayla had just started Soul Sounds Music Therapy, and we decided that we wanted to work in collaboration because it can be really isolating working within your own organization. So we joined together and created Soul Sounds Music Therapy as a partnership. And now, as Joan mentioned, I'm also doing a master's degree in social work. I'm very passionate about helping people and education and lifelong learning. And yeah, again, I feel very thankful to be able to continue that and really privileged to be able to be there today. We don't work in isolation. So within Soul Sounds, there's myself and Kayla. And then we also have a music therapy internship student. Her name is Bobby. Bobby will be completing her internship in the next couple months, and we'll have a new internship student come on board in September. And then we also offer virtual music therapy with Kira. So one thing that COVID has taught us is how to adapt and shift to be online. While most of our work remained in person, there was an opportunity, and there continues to be an opportunity to create music therapy as a more accessible practice by offering it online. So we're really thankful that we have Kira, and she does great work online as a music therapist. So this is the part that I'm most nervous about in the presentation because I'm not very tech savvy. So I figured I'd put it out in the beginning. I'm hoping you can all go onto this QR code here. So you just scan it with your phone. And then I think Kayla just put in the chat as well, a link that you can also follow. And answer the question, music makes me. So it'll prompt you to put in some words. And I believe for this to work, I'm going to have to stop sharing my screen for a sec. So we're going to get to see everybody's names again, and then we'll pop back on in a minute. I'll give you a minute to fill it out, and we'll see what music makes us. So I can see, you can't see it, but I can see that answers are coming in, and I'll give it another little bit here.
That's great. If you don't have a phone, I see some people are putting notes in the chat, which is wonderful.
Oh, that's great. Okay, I can still see the words coming in and moving around, so I don't want to cut you off, but I'm going to go, oh, there's one more. Okay, I'm going to go back to presenter view, so I don't think it's going to update it again, and let me share my screen one more time. And I think this is the one that I want to share. So can everyone see that? Yeah? Okay. So we created this, and really what I wanted to highlight is that we know within the wisdom of this room that music innately moves us. We know that music has the power to shift our emotions. It makes us feel motivated, to feel peaceful, to feel my feelings. It brings back memories. It's fun. It connects us with one another. Music has a great beauty. And I think it's important to remember the wisdom that we have in this room, and to know that we know that music is moving. But the inevitable question that we come to is, what is music therapy? So music therapy, the official definition, is a discipline in which certified music therapists use music purposefully within therapeutic relationships to support development, health, and well-being. And I will probably bring this up a couple times, and I often say it, it's hard to describe music therapy without seeing it in practice. So the way that I think of music therapy and the way that I think of what I do is I tap into that innate ability of music to move people and my knowledge within the helping profession and within verbal counseling to help people reach therapeutic goals. And those goals could be physical, they could be cognitive, they could be emotional, whatever they are. And we'll get into the domains in a moment here. That's my role. And I feel very grateful that I get to have that role in somebody's life. So to become a music therapist, a certified music therapist, you have to kind of go through the gambit a bit. So you start off by being a member in good standing with the Canadian Association of Music Therapists. So they are our national governing body, and we also have provincial governing bodies as well. You have to successfully have completed a minimum of a bachelor's degree in music therapy from a recognized institution. So here within BC, we have one university that offers music therapy training, and that's Capilano University in North Vancouver, which is where Kayla and myself went. And so the program in itself, it starts, you enter it in third year. So there's an expectation that you've completed a year of psychology and a year of music training at an undergraduate level. And then you enter the program in third year, you audition and interview. And then you spend the next 2 years kind of doing three main components of learning. The academic side, which teaches you how to work within a therapeutic relationship, group dynamics, conditions of adulthood, of childhood, human behavior statistics, all of the things you would normally expect. But you also take music instruction. So you take lessons within the three core instruments, which are guitar, piano, and voice. And then you also, throughout the program, complete 3 unique practicums within unique populations. So that includes typically long-term care, something with children, and something within adult mental health. So then you come to the end of those 4 years. It's a very intense program, and you think, gosh, I've done it, I'm good. And then you remember that before you graduate, you have to complete a 1,000-hour internship that is supervised by a certified music therapist. So that typically takes folks around 6 months to a year, depending on how, if they're working at the same time and all of those considerations. And then you get to graduate with your bachelor's in music therapy, which qualifies you to write and pass the board certification exam for music therapists, which is the same in the United States as it is in Canada. We write the same exam. And then once you've passed, you get to sign a statement of adherence to the CAMT Code of Ethics and Scope of Practice. So it's a long process, but I promise it's worth it. And then you become a certified music therapist. So now that you know how you become one, typically the question is, well, what do you do and where do you do it? So the scope of practice is kind of hard to contain within one slide, but I wanted to highlight the places that we typically work in, which includes long-term care and assisted living facilities, day programs, hospitals, hospices, rehab centers. We also work a lot with youth and adolescents. That could be in schools, in programs outside of schools, and then we often work within a private practice as well. So it's really across anywhere where folks might be looking for some extra support, and it's not really specific to one area. And we work within the whole lifespan. We work within NICUs and within hospices too. And how we work is through adhering to the therapeutic process. So typically it starts with a referral, whether that be from a self-referred individual who's seeking music therapy for themselves, or also within the multidisciplinary team or the interdisciplinary team. We often get referrals from nurses, doctors, rehab, we get it from recreation therapists, so on and so forth. Then we move on to an assessment, which can often be integrated within the first session, but it follows a formal assessment that can be written and on our observations. And this also is a time that may be different from other helping professions. We'll assess somebody's music abilities as well. So we see what instruments are accessible, what types of music they like, so on and so forth. Then we go in, and that assessment informs us as to our treatment plan, where we write goals and objectives, and those are always with collaboration from the individual themselves and their care team. And we write those goals and objectives to help reach our 7 domains of assessment and wellness. Then we move on to the intervention. That's the real bread and butter of what we do. And our interventions are always person-centered and strength-based. Then we move on to evaluating, which we do consistently throughout, where we ask questions like, are we really helping to reach these goals and objectives? Are those goals and objectives still appropriate? And how will we shift what we're doing? And we assess the ability that we are actually reaching those goals and objectives. And then we move on to closure. As you're listening to this, it's probably evident that I think music therapy, but specifically the program that we attended at Capilano University, really follows a humanistic and strength-based approach. And so closure to us is incredibly important. We always want to help facilitate that, whether it be the end of someone's life, or maybe they're moving on to a different program or a different facility, or maybe it's just come to a time that they no longer need or want to access our services. So our 7 domains of wellness, which is actually called our 7 domains of assessment, but I think it's better conceptualized as a practice of wellness and holistic wellness. We work within the physical domain, communication domain, cognitive, musical, emotional, social, and spiritual. And while we write our goals and objectives and we plan our interventions to help reach these goals, and we compartmentalize them in this way, I do think it's important to recognize and highlight that we as humans are not compartmentalized in this way. So let's say, for example, I'm asking folks to engage in a hello song. I'm probably going to put that under my social domain, because what I'm asking is you to say hello, how are you, engage in a social norm activity with one of your peers. And maybe my goal is to increase your peer connection. However, within that goal and within that intervention, I'm also reaching the physical domain. Maybe you're giving a wave, maybe you're handshaking with someone. We're engaging in the communication domain. You're saying hello, you're expressing yourself. The cognitive, the musical, I'll probably ask you to sing it. We're touching into the emotional. We're asking, how are you? How are you doing today? It's an opportunity to check in. Again, it's social, and it's also spiritual in the sense to me that it's saying, I see you, I value you, and I want to connect with you. So we as people and the interventions that we do, they typically address all of our holistic wellness, but we're an academic profession, and so we want to compartmentalize it and make it make a little bit more sense in our written form as well. So that's a bit of an overview on what music therapy is. It's a brief overview, and I'm sure you're still wondering what it looks like in practice. But really, it looks different in practice all the time. And so it can be hard to really summarize it in a way. But I hope that answers some of those questions. And I want to move on now to talk a little bit about the practice of music therapy in aging and wellness. So to start off, you can answer this in the chat, or you can just think about it. I'd ask you what you associate with aging, because I know that I have a bias, and I assume that you do too, about what aging is and what aging looks like. And I'd ask you to think about, what do you associate with aging? What are the common things that people in your community say about aging? How do we value aging? And I think I'm surrounded by folks who are aging well, and I value aging, but I think our community probably has some growing room here, which is summarized in Maggie Kuhn's quote. There are 6 myths about aging. 1, that it's a disease, a disaster. 2, that we are mindless. 3, that we are sexless. 4, that we are useless. 5, that we are powerless. And 6, that we are all alike. And I would argue this is one of our great disservices that we do in our community, is that we don't value aging the way that it should be. But that's my own soapbox, and I'll stand on it all day, every day. And it's not true. So when we look at aging in Canada, around 50% of older adults rate their health as excellent or very good. And that's something that we get to celebrate. We know our population is aging. We know that we're going to see an increase in folks who are within the realm of older adults. And it's important for us to value wellness and to help promote that. And I do want to pause here for a moment and highlight that when I step in somebody's process of aging, it's typically because they're looking for some extra support within something. And so I see a lot of the challenges that we have with aging, but those are not universal. And so there might be a bias for the information that I'm presenting now about what's going on, but I do really want to highlight that strength-based approach and saying that while we're looking for a little bit of support here, not everybody is. But we do know that there are some things that you can expect to happen when you age. There's sensory changes, there's cognitive conditions that might come into play. So I work quite a lot within the realm of dementias and cancers and end of life, but there's also things like arthritis that come into play. There's cognitive aging, which I know is talked about in research a lot, and I focused quite heavily on my psychology degree in cognitive aging, but there's normal cognitive changes that happen. And what I don't think is spoken about as much, and I'll get up on this soapbox again and say that a normal cognitive component of aging is also the wisdom and knowledge that we collect and that we should value. And again, I think that is silenced often in the discussions that we have of neurology and our brain as we age. There's also a component of mental health. So as you age, you might be more at risk of depression and isolation and anxiety. I would argue that that's more of a societal problem. Mental illness and poor mental health is not a natural factor of aging. And also on the positive side, we typically see a lot of meaning making being sought out in aging as we look at mental health. So really what I'm saying is the aging process is universal, but it's not uniform. It doesn't look the same for everybody. And I hope we can keep that in mind as we move forward to the following information. Everybody wants to talk about music in the brain. I get it. I want to talk about music in the brain. So the way that I conceptualize music in the brain, and as we consider aging, is within 3 kind of categories. The first is music as protection. So we know that there's quite a lot of evidence coming out and has come out in support that music and learning music can promote neuroplasticity and improve cognition across a lifespan. That's great. That's awesome. I think that's something that we should celebrate. And we also then can tap into those abilities of music to look at rehabilitation. And because music is multimodal and because it's naturally motivating, it can be a really useful tool that we have for neural rehabilitation. And also there's the component of music and memory, which I think is really fascinating. And it helps folks maintain, form, and access their memories. And so we work a lot within dementias. Music is, I'm sure everybody, or I shouldn't say I'm sure, I suspect most of you have heard of Alive Inside, the documentary. It shows these beautiful, picturesque examples of folks who are living with quite progressed diseases like dementia, opening up and singing and dancing, and those things happen. And I kind of want to highlight one other idea, because I think people can have the assumption that if you're living with dementia, even late stage dementia, there's no ability to form new memories. So in my own anecdotal evidence, I always start off a session with a hello song, and then I go on and do individual hellos. And my hello song that I use week after week goes, I'm going to pick on Kayla because I know her name and she's right below me. It goes, hello, Kayla. Hello, Kayla. Hello, Kayla. It's nice to be with you. And maybe I'll change it up and go, hello, Kayla. It's nice to be with you today. Hello, Kayla. I'm glad that you are here. But without fail, people learn the song. They could be in the complex care unit in a long-term care facility. They could be nonverbal. They could be incredibly isolated. They learn the song and they sing it back to me. And it takes time, and they probably don't know my name or don't remember my name, but they'll sing often back something like, hello, Kayla. And Kayla will go, hello, sweetheart. Hello, Kayla. It's nice to be with you. And so that song and that connection and that music, it taps into our brain and it forms this memory and this feeling and this association. And I think that is incredible, and it blows me away every time, and I love it. If you're interested in learning some more about music in the brain, I would highly recommend these resources. One of them, you might have already heard about them. It's This Is Your Brain on Music by Daniel Levitin, and also Musicophilia by Oliver Sacks. And then there's a TED Talk by Alan Harvey called Your Brain on Music, and he's a neurologist and also a musician, and he starts it off by singing, so he had me there and I knew it was going to be a good TED Talk. So then let's move on to music in your body. As we saw in our word cloud, music is a natural motivator to move. We can maintain a range of motion when that decreases, typically with age. Also, it helps facilitate movement and stretching within arthritises, and it encourages purposeful and rhythmic movement. And it encourages us to dance, which is a form of connection with one another. And also we have a form of music therapy, a specialty called neurologic music therapy. And that typically intervenes here in movement within gait training. So we use music as a motivator to help encourage gait training. And also within Parkinson's patients, we can see that stepping and walking can be helped facilitate by purposeful rhythmic music. And also when you have somebody who maybe experienced a stroke and they have some sort of a hemispherical neglect or weakness, we use music as a way to engage that side of their body. So maybe that's encouraging them with an adaptive instrument to wrap a bell around their hand and shake that hand that maybe is experiencing some weakness. We often integrate those interventions within our care. And also it's fun. It's fun to move to music. It's fun to dance. It's fun to, get up and move, and it feels good. It just does. And then we can move on to mental health. And so there's a lot of evidence out there to support that the use of music as an intervention for the treatment of depression and anxiety within older adults can be really effective. And also when we look at mental health within aging, I think it's important to highlight isolation and how music therapy and the way that we structure what we do can really combat isolation. I don't know how many times I've been told that so-and-so only comes to music therapy. That's the only thing they come to. It's the only thing in their week that they engage with. That has engagement with staff, with me, with peers, with themselves. It helps them remember who they are. And so music therapy, there's a lot of evidence as well to help support that it decreases isolation. And then we have connection and community. So following within that discussion of music therapy combating isolation, we also have a community that has meaningful connection when we engage in music therapy and in music. So we often provide group music therapy sessions. We have community-based music therapy that people can come to and gather and share their experience with. And also, it doesn't have to necessarily be a specific music therapy group. Joining things like choirs and bands, like that's tapping into that innate ability of music to move us and to help us connect with one another and ourselves. And there's also some growing evidence that helps support the intergenerational engagement of music. And there's lots of pilot projects that look at bringing in daycares to seniors' homes, long-term care centers, assisted living, and having a music therapist come and help facilitate a group with those folks. It's an opportunity to get to share what's meaningful for you. Again, it's fun. I think that can't be emphasized enough. It's fun to come to these kinds of things. And then finally, I wanted to touch on that aspect of meaning making. So something that we do in intervention, I can give a short example, is legacy work. So we offer a legacy songwriting project. It's pretty tailored towards end of life care, but we use it all the time in our work, whether it's end of life or just through aging. That creates a legacy song with that individual. And we write it together, we record it, and it's something that can live on and can be a real experience of meaning making for somebody. We also engage in lyric analysis and purposeful playlists. One of our group projects or our individual projects within the music therapy program was to create a life review of music, of songs. So it's an opportunity to look back and break your life into these stages and think about, is there a song that was really important to me at that stage, or a song that I know now that really reflects that stage? And I at least found that as an incredibly profound experience that I got to engage with and to sit and listen to that playlist from start to finish. So I hope that information can highlight that music therapy facilitates all of these things. It facilitates purpose, creativity, the right to self-determination. It helps you connect with your identity, with who you are, with your spirituality. It gives you energy, an opportunity to express yourself. Really, what I'm saying is music therapy facilitates quality of life and wellness, and that includes with aging. And furthermore, I think it's important to recognize that later life has often been depicted as a period of profound creativity, where older people use creative outlets for reflection on their own unique stories, their personal healings, and problem solving. And that is, like I said, a great gift that I get to have to lay witness to that practice. I'd also highly recommend another book plug here. So it's by Jennifer Buchanan, and she's actually the ED, the executive director of our Canadian Association of Music Therapists right now. She's written quite a few books. She's very wonderful, and she has a book out right now called Wellness Well Played, and it's very interactive. So I've been told. I haven't read it, but Kayla did. So I'll be honest with that. I'm in a master's program. I don't have time to read much these days. So I hope that you come away from that bit of information summarized by Dr. Oliver Sacks, who wrote Musicophilia and is one of my personal kind of heroes. He's one of my top 5 I'd like to have, a dinner with. That music brings back the feeling of life when nothing else can. So we're gonna now, how are we at time-wise? Okay, we're good, but we're a little tight, but we're going to engage now with some really fun participation, and I promise it's going to be fun and it's going to be accessible. I will kind of lay out some ground rules that this is going to be a space of acceptance and respect and vulnerability. I'm going to ask you to be a little bit vulnerable, and I hope that we can engage in that really intentionally. So I'm also going to put a pause here and say maybe we could stop the recording. And then just to very, very briefly, because again, I'm aware of time, um, let me just pull up what I would like to share with you. There we are. So you can find out more about us and music therapy. We have a website, soulsoundsmusictherapy.ca. Our email is soulsoundstherapy@gmail.com. And then we also have a Facebook and Instagram. We have an upcoming community group that's going to run through the summer. So starting in May, it's called Whole Rest, and it's music and relaxation in collaboration with the Rotary Center for the Arts. All ages and abilities are welcome. I don't have a ton of information about it right now because it's down the line a little bit, but you can follow us on our social medias or our website and we'll have more information there. And just to say thanks. And normally I like to end with a song, and I was going to sing you We'll Meet Again, but I'll just leave you with the lyrics instead for time, which is we'll meet again, don't know where, don't know when, but I know we'll meet again some sunny day. So thank you all. I really appreciate you being so engaged and listening, and yeah, I feel very grateful. So thanks everyone. I'm happy to answer any questions that you might have or comments or concerns.
Great. Thank you. Wow. On behalf of everyone, what a session. This was really, really lovely. But we do have some time for questions, about 10 minutes. And I see there's one from Eric here. Very sweet and clever. I'm sure he was talking about your song making and your singing. It was beautiful. But is it complicated for engaging participation?
Yeah, so if I'm looking at doing an intervention within aging, I probably, first of all, I would spend an hour doing that songwriting and really simplifying the questions and tailoring it to that individual. So I would say I do quite a lot of songwriting and rewriting. I actually wrote a short little EP with some folks at Pathways, which is a diverse abilities organization. So part of my work is to make things accessible for folks. So I would say it's as complicated as I make it, but it can be as simple as how are you today, and hearing good or bad or stressed and integrating that into a song.
Great.
So I hope that answers that.
I think Kayla, the other Kayla, the Kayla participant has her hand up. And I wondered, Kayla, if you had a question, if you want to unmute yourself or comment. Oh, that was an accident. No problem. No problem. But we do have a question. Does music therapy combine with reminiscence therapy?
Yeah, so I would say Reminiscence as the therapeutic tool, we use it constantly. I'm not super familiar with reminiscence therapy in its own, like standing in its own right. But yes, reminiscence is almost always part of our goals when we're working with somebody in long-term care and with aging.
Okay, great. And that was a question from Jonah. And then Marilyn asks, is there evidence that music is a preventative towards dementia as a way of, brain health, I guess, at any time?
Yeah, so that's a complicated question. There are some theories and there is some evidence to suggest that somebody who has engaged in music learning and music expertise might have a lower risk of developing dementia. And that kind of goes along with this idea of, or a theory of dementia of cognitive reserve. But there is also an idea that instead of it being preventative, it can be a real form of slowing progression. And so allowing, the progression of dementia is very unique to that individual and the type of dementia that they have. But music can be a really beneficial tool to come in and help maintain memories, help maintain functional abilities. So something that Kayla does really well is she writes songs for daily living activities that somebody can have in that moment to kind of encourage them with what their next steps might be, and so on and so forth. It's a lot easier to learn and remember and retain a song than it is written knowledge or a poem or spoken word. So hopefully that kind of addresses it. There is some evidence to suggest that it is a preventative, it can help in prevention, but it's kind of that chicken or the egg and so on and so forth when we look at dementia prevention.
Yeah.
It's a very complex realm.
Kayla, I don't want to put you on the spot, but are you able to sing a couple lines of one of those songs you would use to help people remember their daily activities?
She sure can, Joan.
Oh, okay. We'd love to hear from you.
Oh goodness, like I write so many, like as simple as having a song for helping a kid with autism putting on deodorant. Or helping them put their clothing on. I'm just trying to I'm feeling very on the spot here. Let's see if I remember any of the songs.
Maybe Kayla, you can think of that and I can answer one of the questions I saw above, which is any Vancouver sources or resources. Yes, there is a lot more music therapy going on in Vancouver than there is in the Okanagan. So if you are looking for a music therapist, I'd say your best bet to begin with is going to the Music Therapy Association of British Columbia, and you can put an inquiry in there, and then they send it out to all of their members. Also, I would say almost all long-term care facilities, hospitals, so on and so forth, they have a music therapist there already. And there's tons of community groups in Vancouver as well. So many resources. If you have something in particular, you can always send us an email and we can help direct you to the right person.
That's great. That's great. There is one question also from Eric. When I visit and sing with seniors, other cultures, and some who forgot English because it's their second language, any suggestions to engage everyone?
Learn music in their language. That is my suggestion.
Okay.
I can say hello, how are you? I'm good, thank you, in many languages, just because I learn them. There's also like learning. So it's very important to me in my work that I call them connection songs, that I engage in music that has a connection with that person. And so if they're connecting with music in their first language or their culture, do that music. You can listen to recorded music if that's not your area of expertise. But like, for example, in German, there's very simple songs like there's a song that goes, du liegst mir im Herzen, du liegst mir im Sinn. And every German person I've met so far knows it and sings along to it. And there's a section that goes, yeah, 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 yeah. And everyone can sing to that. So yeah, have it be in their language is my advice.
That's great. Okay, we're going to come back to you, Kayla.
Okay.
Come on, Kayla.
So this one was in collaboration with the behavioral interventionist. So with a social story. So this one's for brushing your teeth. There's a lot of teeth brushing song, but this one was individualized for this client. So it goes like this. It's time to brush your teeth. Pick it up, come on, let's go. Put your toothpaste on. Toothpaste on, toothpaste on. It's time to turn on the tap. Put toothbrush under the tap. Get your toothbrush wet. Toothbrush wet, toothbrush brush. Brush top, front teeth, 1, 2, 3. Brush top, front teeth, 1, 2, 3. Then you go to your bottom teeth. Brush front, bottom teeth, 1, 2, 3. And then it goes on and on.
That's great. Thanks so much.
And Kayla like records it for the family so that they can play it at that moment too, to prompt them. And yeah, it's great.
That's fabulous. That's fabulous. I had no idea that we could do that with songs, but that's great. Yeah, so we will post the recording, and because all of you have registered, you will get a link from Jaquetta with the recording. And it'll be up on our YouTube channel. And so you'll be able to share the link with colleagues, friends, family members who also might be interested in hearing a little bit more about music therapy. And I think we're almost to the end. And I do want to really, on behalf of everyone here, a very big and warm thank you to Lizzy for this fabulous introduction to music therapy, and for Kayla for your lovely song and assistance. We really enjoyed your singing today and all of the information provided. And I think everyone here can wholeheartedly agree we have wonderful students at UBC, and wish you all the best as you finish your master's in social work, and look forward to crossing paths again sometime in the Okanagan. So as we close, I want to encourage everyone to also check out the rest of the events for Embrace Aging. We're only at not even quite the middle of the month, so there's still lots to come. And on Monday in particular, we're hosting a primary event, Andre Picard, who is speaking about the pandemic and what we can look forward to in the future based on what we've learned over the past 2 years. And given that I heard on the news today, it's the second anniversary of the first announcement by WHO that we were actually in a pandemic. So it seems kind of timely for reflection and looking forward. So do join us if you can, and any of the other events that we have on. And once again, thank you to Lizzy and Kayla, and thank you to everyone for joining us today. Bye for now.
Thank you.
Thank you.